Those workers must be fully vaccinated by October 1st. But if they're going to meet that deadline with the now approved Pfizer vaccine, they have a much closer deadline to hit. News Center Maine's Hannah Deneen joins us now from the state's largest hospital, Maine Medical Center in Portland, with more on that. And Hannah, I understand you spoke with one health professional who says she'd rather quit than get vaccinated.
That's right, Pat. And like every healthcare worker across the state, she's facing that October 1st deadline, but she doesn't plan to meet it. We'll get to that in just a moment. But first, for those healthcare workers who do plan to meet that deadline and they'd like to receive the Pfizer vaccine, well, they're going to need to get their first dose in the next 2 days. This Friday, August 27th, is the last day a healthcare worker can receive a first dose of the Pfizer vaccine and be fully vaccinated by October 1st. For the single-dose Johnson & Johnson vaccine, it's September 17th. The window to receive a first dose of Moderna passed on August 20th.
I saw what the COVID virus was doing firsthand to patients, and it was horrible, and it was terrifying. And that was ultimately what made me make my decision to get the vaccine.
Central Maine Medical Center travel nurse Andrea Dyer was vaccinated last December. For her, it's about protecting her patients and her loved ones.
Ultimately, protecting my grandmother, protecting my nephew who has asthma.
More healthcare workers have been getting vaccinated since the mandate was announced, according to Maine Health's Dr. Dora Mills.
What we've been having is one-on-one conversations and just trying to address the issues that they have, the concerns they have.
Dr. Mills says vaccine mandates for healthcare workers are nothing new.
They're already vaccinated against measles, mumps, rubella, chickenpox, and hepatitis B. So this simply, and influenza, this mandate simply adds another vaccine to existing requirements.
According to the most recent CDC data from July 31st, just over 80% of hospital workers in Maine have been vaccinated. Maine General Medical Assistant Olivia Turner is among the 20% who haven't.
I am not going to get the vaccine. I am very firm on my belief.
For Turner, the decision comes down to concerns over potential side effects and a general opposition to government mandates. With that in mind, she's been prepared for this mandate since May.
When I started hearing that there was going to be a push for mandates, that you just hear it through the grapevine, of course, being in healthcare. I started a cleaning business.
When the mandate goes into effect, she plans to run the cleaning business full time, but she's leaving medicine with a heavy heart.
When I wear scrubs, I'm proud of what I do. When I am taking care of patients, we all have it in us. People who work in healthcare, we love what we do, and there's not another job like it.
Online and at rallies, she says she's heard from many others who also plan to leave the medical field.
From what we've seen, they're not going to cave.
Leaving the future of the industry in guarded condition. Now, this healthcare mandate does not just apply to hospital workers like the ones who work here at Maine Med, but also other healthcare groups like nursing home workers, also assisted living facility workers. You can find a full list of all the healthcare groups on our website and mobile app. Live in Portland, Hannah Deneen, News Center, Maine.
Thank you, Hannah.